Hello, I'm Eric, co-founder of Delos Therapy. Today we're going to be talking about how you can help yourself with plantar fasciitis. I'm with Gina, who is co-founder and CEO of A Sweat Life. So she will be our model today. So first let's talk about what causes plantar fasciitis. So if you look at the bottom surface of the foot, typically what happens is a patient will get pain right here around the heel. So what's happening is the muscles of the calf, the tendon of the Achilles, and the muscles on the bottom side of the foot are all pulling, causing pain right here. So a very effective way to get rid of it is to loosen up all of the muscles of the calf and all of the muscles on the bottom of the foot. The way that we do that is we apply direct pressure to those muscles, forcing those muscles to stretch. So what I'm going to have Gina do is apply pressure directly on the underside of the foot. So you want to find an area that feels tight and that is tender. And you want to hold pressure directly into that spot, okay? So typically we hold pressure for about 3 seconds, 2 to 3 seconds. So in your mind, think about what you're doing. When you're holding pressure to a muscle, you're actually forcing that muscle to stretch. So people typically think about stretching lengthwise. So let's actually stretch the muscle lengthwise just so you have an idea. So you'll kind of feel this kind of a stretch. That's actually stretching the muscle apart this way, but that's only stretching in one plane. Really what we want to do is we want to stretch the muscle directly into it. So anytime you apply pressure, you're forcing those individual muscle fibers to stretch and separate at the location of the pressure, which is a very unique way to stretch the muscle. So what we do is we take the muscle tissue on the bottom of the foot and we apply pressure at distinct points all along the bottom of the foot. Now how does that feel?
So great. And we're using a knobble, which you can get online or you can get at a Delos Therapy office. But if you don't have a knobble, you can use a lacrosse ball at home. Yeah. Or what else, Eric?
Anything that's pretty hard. You don't want something that has a lot of give, because keep in mind, the pressure is very important directly into the muscle. So if it's very soft and it has a lot of give, it won't distribute the force into the muscle. And you really have to break up that tightness. So depending on how tight that muscle is, a decent amount of force is needed to force that separation. But one critical part is you don't want to massage it. So keep in mind what you're doing is you're stretching directly into the muscle. So if you start to move, you're distributing the force away from the muscle. So it should be static pressure. So I typically tell patients, hold pressure for 2 to 3 seconds, lift up, go to the next spot. So if you're using a foam roller, for example, a lot of patients are rolling back and forth. If you think about it, if you're rolling back and forth, you're actually just going over the surface of the muscle. If you are using a foam roller, apply pressure, come out of it, then you can roll to the next spot, but then you want to apply pressure at that next spot.
Okay, so I've done the grid all along my right foot. I'm going to move to my left foot. And here comes the fun.
To get a little bit deeper into the tissue, we can do something that's called a pre-stretch, which I know Gina loves.
Me too.
If you really think about what we're doing, again, we're stretching apart that muscle with direct pressure, but what you can do is you can apply a stretch lengthwise to the muscle, which is what typically people are doing to get rid of tightness. Keep in mind, tight tissue doesn't stretch effectively that way, but you can pull everything taut and then apply pressure on top of that. So what's happening when you're doing that is you're actually stretching in multiple planes, and that's an extremely effective way to break up that tightness. So I can do it for you. Okay. Yep. So I'm stretching it lengthwise now.
That helps.
Yeah. It increases the intensity for sure.
Yeah.
And then you go to a different spot.
So if I were to do this at home, I would just reach down my own foot and pull up on my toes.
Yeah. Because what you're doing there is you're pulling all of those muscles taut, and then you're applying pressure at the tightest areas.
Oh yeah, this
So you're
helps.
stretching in multiple ways. The foot is very muscular. It actually has 4 layers of muscle in the foot, each layer having multiple muscles. So it's a common area of wear and tear. You use your feet every single day. Every time you're standing, walking around, running, anything that you're doing is using the muscles of the foot. Wear and tear causes muscle tissue to get tight. And unfortunately, the knowledge isn't really out there that once a muscle becomes hard, that's a very, very important turning point in a muscle. Muscles should always be soft and pliable. So I always do this as an example to show that my forearm is soft and pliable, but when I flex it, this is all very hard, but when I relax, this is soft. So any area that hurts or feels stiff, feel the muscle tissue. So if you have plantar fasciitis, feel the muscle tissue on the bottom of the foot. I can almost promise you it will feel rock hard.
Yeah.
So if a muscle feels hard in a relaxed state, what does that mean? It means it's chronically tight. It's perpetually in this locked up state. That's an important turning point, because at that stage of tightness, it will not pull apart with stretching.
So we finished the left foot at home. We're going to move on to the next area, which will be going up the calf. All right, what happens next?
So as you've loosened up the bottom of the foot, you want to make sure that you understand that the fascia is connected. There is actually, and this is a semi-recent discovery, there's a completely dissectable line in the body called the superficial back line that actually runs from the bottom of your foot all the way up your Achilles, calf, hamstrings, glutes, back, cervicals, occipitals, and attaches to the muscle called the frontalis, where they can literally dissect it out in one plane. So it's important to understand that theoretically anything along that line can cause some pain downstream of that. So we want to loosen up everything that's closest to where the pain of the heel is. So that would be the Achilles, and that would be the calf. It's the same idea. So you want to start at the bottom of the calf, a little bit above the Achilles tendon, and apply direct pressure right into that muscle, forcing it to stretch. And it's the same idea. You apply pressure at one distinct point, move ½ inch, and move up the calf.
Ooh. So if I want to give more to this, I'll cross that other foot over.
Yep. It's really micro stretching. We're really stretching individual muscle fibers. So every movement is important. So you don't want to move, 3 or 4 inches between spots, because then you're missing all that tissue. And tightness is always three-dimensional. So you can think about applying that stretch with the pressure, but also coming in at multiple angles.
So once I get to sort of the top of this area, should I head back down?
Yeah, so you want to get all the way through the calf.
All the way through the
Yeah.
Oh, I'm going through the calf now.
Yeah, you want to get all the way through the calf, and then you can think about going down the center of the calf and then coming out slightly laterally and slightly medially. Always keeping in mind, tightness is three-dimensional, so you have to come in at multiple angles.
This is great for me.
Good.
I love being in your videos.
And what you should feel is, you should feel that every time you go through the area, the sensitivity should decrease a little bit. You should feel that there's a little bit more give in the tissue, so you can feel that pliability starting to come back. So the tightness or the hardness of the muscle is starting to soften. And what you'll notice over time is, as everything loosens up and sensitivity goes down, then that strain of the muscle tissue at its attachment point goes away.
So now that I'm at the top,
Yep.
should I sort of angle my calf?
Yeah, you can angle it, yeah.
Going
And then you want to go back down, yep. So you can go up and down the same line. You can go up one line, one particular line, and then down another. So, there's no real rule. Just the only thing to be careful of is make sure the pressure is precise. So you're not wobbling, you're not moving around. Any kind of wobble, any kind of movement can be irritating to the tightness, and it's dispersing the force away from the tissue. And also, thumbs are always an option. So you can see, like, if I wanted to work through the inside of my calf, I can take both thumbs and I can apply pressure right next to the shin. And you want to use both thumbs, use the flat surface of the thumb. You can come in a little bit sharper using the tips of the thumb, but that's concentrating the pressure, and that can be a little bit tender. It's fine, just make sure you're not going too hard. I've seen patients come in with some bad bruising and damage to themselves because they do this for 4 hours or so.
Oh man, I'm moving.
They just get a little excited.
Of the calf now.
Yeah, a little bit hard to do the outside with your thumbs, but it can be done. It might be easier with a lacrosse ball or knobble, but the inside is actually very easy. So come right through the inside of the calf, inside of the foot, back side of the calf. So all of this can be done with thumbs or a tool. And if you have a history of tight hamstrings, also be thinking about that superficial back line that runs all the way up the posterior side of the body, because the pain in the heel could be coming up way higher. It could be coming from the back. It could be coming from the glutes or the hamstrings. This typically knocks it out, working distally towards the area that hurts. But you always have to be aware that line of tension could be becoming much higher. All right, let's move on to the right calf. You always want to make sure you're loosening up everything bilaterally, so both sides. Just because one side hurts and the other side doesn't hurt, don't be deceived by that. The most common progression I see in the clinic is it starts in one and progresses to both.
So Eric, as I'm moving up this calf, I'm wondering, I feel like I'm pushing pretty hard to get sort of the same sensation I got on the left side. How hard should they push at home?
Yeah, I typically tell patients it's the maximum amount of pressure that you can tolerate without any guarding, right? So as soon as it starts to hurt and you start contracting because it hurts, you know, just think of the physics alone. If you're tightening and we're trying to loosen at the same time, those are opposing forces. So it will hurt. Pushing into tight tissue hurts, but it should be a good hurt. We hear a lot of patients say it hurts so good.
So I'm still moving up that medial calf, and I can't help but think about all of my friends who wear high heels. And I know that many of them end up with pain in their feet and pain in their calves. So it can't just be runners who experience plantar fasciitis, right?
No, I mean, it's anyone that is repetitively using those muscles. So you can imagine the strain of high heels, right? Directly affecting the calf and the foot. So the more, I'm not against high heels. What I'm saying is that the more you're dancing, the more you're running, the more you're wearing high heels, the more time you're spending on your feet, the more likely it is that your calf and your foot are going to get tight and at some point cause some kind of symptom.
So I've gotten to the top of that midline of the calf, and I'm going to move to the inside like I did on that first side, angling that calf out. Ooh. Yay!
Yeah, and so again, you know, you can use a knobble or a lacrosse ball, a tennis ball. Tennis ball might be a little bit too soft. Golf ball might be a little bit too small of a surface area. But I know the inventors of the knobble, they had the idea that applying pressure to a muscle does something, and it concentrates that pressure right at that exact spot. So the knobble, I think, is fantastic because it's small. You can keep it in your bag or your purse. You can travel with it. I went to a conference recently. I brought it on the airplane. It was really, really great because you get a little bit stiff sitting on the plane.
Almost to the bottom of the inside of the calf. About to move to the outside of the calf. So the goal here, Eric, is not just to be in pain. The ultimate goal is muscle health, right? And what does a healthy muscle look like?
Yeah, actually it shouldn't hurt at all, right? So healthy, spongy, pliable muscle does not hurt with pressure. It should actually feel like a stretch. It should feel very good. But when muscle tissue gets tight, it becomes congested. There's not a lot of blood flow. There's a buildup of lactic acid. There's a whole bunch of reasons why that area becomes sensitive and painful with pressure. But if you're pressing into your muscles and they hurt, that's an indication that there's some pathology there. Something needs to be done to flush that tissue. The three most common things I hear all day for patients trying to get rid of that tightness to restore pliability is stretching, foam rolling, and massage. Those things are just not effective at breaking up that tightness. You have to hold pressure. That is by far the most effective way to restore that softness, that sponginess, and that tenderness. We call that pliability.
Yeah. I hope you've been enjoying this while you're maybe winding down from the day. As I hit that last spot on the calf, Eric, anything you want to send our pliability folks at home off with?
Yeah, don't go too crazy with it. I've seen some funny stuff in the clinic where people will do it 2 or 3 hours and they'll be so bruised up that when they come into the clinic for treatment, we can't even touch the area. So, spend a half hour on it while you're reading or watching TV or something. It might not be a bad idea to ice the area afterwards in case you induce a little bit of soreness from the pressure.
All right, see you guys back here tomorrow. Let's get back at that plantar fasciitis.